Hey guys, hello everybody. Welcome to the channel The Surgery Times. Please subscribe in YouTube and follow us in Instagram and Telegram group. So today's our topic is femoral canal, femoral triangle, femoral sheath, all about femoral. Okay, the boundaries, the content, and the significance of femoral canal also we will read here. And this is very important for undergraduate student. Also MCQs are coming in NEET PG. Hence remember the silent points discussed over here. Okay, so first of all we should see where the inguinal ring is present. Inguinal ring is present 4 centimeter lateral and 4 centimeter downward to the pubic tubercle. Okay, through the ring as it is an opening, so through that the content of the abdomen can come outside. Okay, that is the omentum and also the intestine, but it is not normal. This is an abnormal, which is, if it is coming out through this, it is called as femoral hernia. Okay, this is the significance of femoral canal or femoral ring specially. Okay, so the marking area is the inguinal ligament, which is present both side, and this is right, this is left. Okay, so right side we can see a femoral canal. Okay, along with that femoral vein and femoral artery. So we will discuss later the content in the next in the next picture. Already it is shown the femoral ring. Okay, so in the femoral canal, most medial to lateral, we have a mnemonic VAN. Okay, VAN means vein, nerve, artery. Femoral vein, femoral artery, femoral nerve. VAN, medial to lateral. You should remember this. And most medially the ring is present, through which the content of abdomen may come and it can protrude outside, and called as femoral hernia. And femoral hernia, remember, in male and female, most common is inguinal hernia, and that's too indirect inguinal hernia. But femoral hernia is more common in case of female. This is the more zoom picture of our groin, and here we can see the boundaries of the inguinal canal, femoral triangle, that is sartorius, then adductor longus, then inguinal ligament. Okay, the base is formed by inguinal ligament, more medially adductor longus, and more laterally sartorius. This forms the triangle, and in the triangle the floor is formed by more lateral. This one is lateral, this one is medial. Okay, from lateral to medial, iliacus, tendon of psoas major, and pectineus. These muscles are present. Okay, and sartorius and adductor longus coming in the boundary. So from lateral to medial, remember SITPA. Okay, this will help you. SITPA means sartorius, iliacus, tendon of psoas major, pectineus, adductor longus. You will never forget. And also along with this formula you should remember the diagram, so that in anatomy exam also it is important to draw one diagram, and from the diagram you should remember forever about the everything, the boundary, the content, all these things. When we are cutting like this and seeing from above, okay, this section we are looking from above, this is the picture we are seeing. So here you can see this is sartorius and this is adductor longus. So here it is lateral, adductor longus is medial. So here sartorius is lateral and adductor longus is medial. So we can see this is the femoral canal bounded by a sheath, that is femoral sheath. Anteriorly presence of skin and superficial fascia, whereas posteriorly this line you can see a lot of muscles are present which forms the floor. That is, this is lateral, this is medial. So adductor longus followed by pectineus, then tendon of psoas major, then iliacus, then sartorius. Okay, SITPA, from lateral to medial. And this is, you can see the sheath, femoral sheath, which is again subdivided by membranous path into 3 compartments. So this is our lateral and this is medial. So medial to lateral, you can see VAN. We have a formula, and femoral vein, femoral artery, and femoral nerve. And you can see the femoral artery is not alone. Femoral artery is associated with one nerve, that is femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve is associated with femoral artery. This is also important. And you can see this is medial, this is lateral. More medial the compartment, there is a presence of lymph nodes are in the medial compartment. Remember this much. Now you can see a funnel shaped structure over here. Okay, the funnel shaped structure means through it, this is the femoral canal, and femoral artery is comes inside it. This is only a picture, it is shown and coming out as a popliteal artery. Now we will jump into the next figure, that is the femoral triangle. Okay, so here also you can see this one must be sartorius, adductor longus, inguinal ligament. Now here this is more visualized about the content of the femoral triangle. So as we already discussed, from medial to lateral, okay, VAN. So VAN is present over here. Okay, femoral vein, artery, nerve. So the peculiarity of this is, and we have also seen the femoral branch of genitofemoral nerve is associated with femoral artery. Okay, femoral nerve also it is detected over here only, and along with that lateral cutaneous nerve of thigh also present in the femoral triangle. Three types of nerve you should remember, and VAN formula. And here what happens is, after coming the femoral artery, it again gives 5 branches over here. Remember the branches of femoral artery: superficial epigastric artery, followed by superficial external pudendal artery, followed by profunda femoris artery, which gives branch of lateral circumflex femoral artery is also branch, and last but not least is superficial circumflex artery. So we should remember about the branches of femoral artery. There are mainly 5 branches over here, which gives inside the femoral triangle. So first of all, we should remember the superficial branches are there. Okay, first is epigastric, second one is external pudendal, and next one is circumflex iliac. Okay, so superficial epigastric, superficial external pudendal artery, superficial circumflex iliac artery. This much you have to remember. Along with that, lateral circumflex femoral artery and profunda femoris artery. These are the branches of femoral artery. Now this is clearly visualized about the triangle and the content and the femoral sheath. Okay, if here we will take a section and look from above, if we will take a section from here and look from the side only, from medial aspect, then we can see the anterior and posterior part of the femoral triangle, anterior and posterior. This is iliacus, as we know, and anteriorly the abdominal muscles that come, and along with that femoral sheath. All here we will discuss about two things. One is more important, that is femoral sheath. Okay, so femoral sheath is formed anteriorly by fossa transversalis and posteriorly by fossa iliaca. Okay, so suppose this is anterior part of the femoral sheath is seen over here, then what I have written above is anterior part, and here it is formed by the fossa transversalis, whereas the posterior aspect is formed by fossa iliaca. Okay, by this the femoral sheath is formed, and it from wider angle it merges into the femoral vessels. This much you should remember about the femoral sheath, and the content already you know. Now this is the femoral sheath all over. In the 3D diagram it is given, and the content is femoral artery, femoral vein, and femoral genitofemoral nerve is also over here. Okay, so guys, please remember all this, about femoral canal, triangle, sheath, and all the contents and femoral artery branches. This is very important. So don't forget to like, share, and comment, and subscribe our channel, The Surgery Times. Stay tuned. We'll meet with the new video very soon. Thank you.